Hi, my name's Sam Grugel, and today I'll be showing you how to read someone's blood pressure using a cuff and a sphygmomanometer. When reading or auscultating someone's blood pressure, you are reading both their systolic and diastolic blood pressures. Systolic, the top number, is when the ventricles of the heart contract, releasing blood to the rest of the body. Diastolic, or the bottom number, is when the ventricles are relaxed and the atria are filling them with blood in between contractions.
According to the American Heart Association, a blood pressure of less than 120 over less than 80 is considered normal. 120 to 129 over less than 80 is considered elevated. 130 to 139 over 80 to 89 is stage 1 hypertension, and greater than 140 over greater than 90 is stage 2 hypertension.
Before you read their blood pressure, you have to make sure that they are seated in a resting position with their legs uncrossed. Once you acquire the appropriate cuff size for their arm, you want to place it around their bicep with the artery marker in line with the corresponding artery. You are going to tightly wrap the cuff around their bicep, leaving the antecubital site exposed.
You want to place the sphygmomanometer's bladder over the brachial artery located in the antecubital site to hear their pulse. You are then going to use the cuff and pump it up to 160 millimeters of mercury. Once you've pumped it up to 160 millimeters of mercury, you are going to gradually release and let the air out of the cuff. Here you'll see that I pumped the cuff up to 160 millimeters of mercury. I then gradually let the air out at a rate of roughly 2 millimeters of mercury per second. You see that the arrow quivers at roughly 115 millimeters of mercury. It is at this point that I hear her pulse thumping clearly through my sphygmomanometer. This is the systolic pressure. At about 70 millimeters of mercury, her pulse fades out and is no longer audible through the sphygmomanometer. This is the diastolic pressure.